Okay, welcome. Dr. Mayakin Ziegler of Monarch Family Chiropractic. Welcome to our Tuesday night spinal workshop. We love our spinal workshops. In fact, I've gotten a couple questions this afternoon alone, talking about some topics related to what we cover in a workshop. And one person said, when I go through my care plan, am I going to, have this rhythm, this routine of self-care? And it is each of our responsibilities to create that self-care regimen for ourselves. And I find that when you attend the workshops and really outline your definition as it relates to health, you start to create a regimen of what is important, what is health to you, and how can you create something on a regular basis to address your spinal health and spinal movement. How can you address the foods that you're eating and how you're feeding your body? How can you address the mental health and the stress related to that? So I appreciate your being here tonight because this helps hold you accountable to doing those things. So understanding arthritis. If you're like most people, the common belief is that arthritis is something that we will experience, all of us. It is common, it is everywhere. It's just the normal wear and tear of our spine. And my goal tonight is to provide you with data to understand that, yes, it is common, but it is not normal. No, we are not meant to have arthritis as we age. And so let's get started. So I want you to understand there are there's multiple diagnoses of arthritis. And my goal is to just go over some of the more common ones and then really dive into the typical arthritis that we think about in looking at spines. But there's something called rheumatoid arthritis, or RA. It's an inflammatory arthritis, and it's categorized or considered an autoimmune type arthritis, meaning if it's autoimmune, your body attacks itself. It's immune driven. Your body no longer recognizes its cells as its own, and it attacks the joints oftentimes we see it in our hands, but it attacks the joints. And so we see pain, swelling, and it impacts joint, damages the joint. And the definitive way to diagnose rheumatoid arthritis is through a specific blood lab called rheumatoid factor. If that is present in your blood, then you have RA, or rheumatoid arthritis. So it commonly affects hands, knees, ankles. Usually it's both sides of the body. And because it's autoimmune in nature, sometimes we see it even can impact eyes, heart, circulatory system, and lungs. Okay. So that is an inflammatory arthritis and autoimmune in nature. Now, osteoarthritis. This is something that I find is commonly diagnosed and utilized in healthcare. It's the typical, I've been given an arthritis diagnosis. This is a lot of times what people are, categorizing it, and it is an overuse type arthritis. You can think about a stress fracture is an overuse type injury where you are doing repetitive motion and movement over and over and over, and it actually those cumulative input in that specific area of the body causes stress fracture, right? Fracture, typically we think major, big impact, but it's the overuse that's often done. And this is repetitive motions. Think about jobs or sports, carpenters, electricians, construction workers sitting at a desk, technology. I mean, if you think of like a tennis elbow where, somebody is constantly cranking on a wrench, that is an overuse, repetitive movement where you start to feel, oh man, I got tendonitis now in my elbow. And if that is there long enough, oftentimes we'll see it impact through the joint. So wear and tear, the body cannot heal damage to the joint as fast as the damage is being done. So this impacts specifically our hyaline cartilage. There is inflammation. It is painful. Chiropractors can identify osteoarthritis early and prescribe appropriate rest and therapy to help joints heal before deformation and disability set in. So a lot of times when it comes to overuse and a repetitive injury, it is rest is the best thing to do. And it's hard because you think about, we live, Monarch Family Chiropractic lives next door to a salon. And these guys are doing the same type of, movement day in and day out, very one-sided. And you talk to some of those guys over there and they're in chronic pain. And it's hard to rest because that's your livelihood, right? Now, I want you to think about degeneration, okay? It's not the result of wear and tear. Degeneration is a result of abnormal biomechanical motions. So very different than overuse in osteoarthritis. I want you to think about degeneration is there's not appropriate movement or lack of movement in a body or abnormal movement in a body. We call it subluxation in the spine. We can see it in your extremities. And when you have abnormal movement or poor movement, that's where we start to see a laying down of bone to create stability and to really be an effect of how that body is moving. Because when let's think about this, because a lot of times people think, as I get older, gravity is just doing its thing and it's just going to start pulling me forward and I'm just going to be here. And when they study whales and dolphins, no gravity there, they are in water, right? They're actually finding that dolphins, whales have arthritis in their joints too. So if we take away the gravity component, we look at how is that spine and structure moving. And if there's abnormal and inappropriate movement or lack of movement, that is the component of degeneration and arthritis, okay? So the more common arthritis that we see with people is subluxation degeneration, which is really considered immobilization degeneration. We are not getting the appropriate movement in our joints. That movement feeds the joints over and over and over. And when we don't have healthy movement, it loses motion, it starts to break down, and immediately you start to have avascular tissue. Avascular means that that tissue isn't getting its healthy blood supply. If you don't get healthy blood supply, that means you don't get nutrition to that area. So when we talk about subluxation and subluxation degeneration, that is malalignment of the spine, that's poor movement, that's bad movement. And that when you lose that healthy movement, which provides nutrition to that joint, then you get poor blood flow and it starts that process of degenerative change. So that's what we're going to focus on. We're going to focus on the subluxation degeneration, that poor immobile movement within your spine or your joints that we see most of the time with people today. So I drew these two joints, and I just want you to see this. So this one on this left side, that's like a knee joint. Okay, that's like an elbow joint. And you've got this cartilage. Anytime you have two bone surfaces that approximate each other, okay, that is a joint. And around the joint is the joint capsule, and the cartilage is the end of the joint, okay? So none of these have their own blood supply and rely on the bone to provide nutrition through diffusion. Think about dipping a paper towel in a puddle of water, right? That's going to absorb that water. Okay, so when the joint moves, it facilitates healthy joint health and allows for the nutrition to be absorbed and circulated into that joint. Okay, so the big thing I want you to hear from that is this joint needs the right kind of movement and healthy movement for blood supply, for nutrition. Okay, same thing happens in this right picture. Right, you've got the discs in between the vertebra of the spine. And when you have healthy, appropriate compressive forces acting on that joint, That means there's blood supply. Well, let me rewind. That means that it's providing nutrition to the joints that a blood supply would provide. Okay. So when you have subluxation or you have poor lack of movement, you're not getting the nutrition that the joint needs. Not a big deal for a short period of time. Big deal when it becomes chronic, because then we start to see this type of presentation. So I want you to see this. This is far left is a cadaver, a slice of the spine, a sagittal view. So we're looking, directly at the bodies of the spine. Next to that is taking the spine only, and then we've got an X-ray. So I want you to see this. You should have a curve in the spine. This is a lumbar spine. So remember, that lumbar spine should look like a banana, right? And you should have nice, thick, fluffy disc space between each vertebra of the spine. Those discs should maintain in their space. Here's the cord. Hey, I don't know if you guys can see my pointer. Here's the cord right here, back through here. And you can see this guy, if we just go right to this X-ray, you can see this disc space has really changed quite a bit. And you've got some bone spurring showing up right through here. Now, from what we know, do you think this type of degeneration is a result of overuse? Is a result of lack of movement and immobility that we just talked about, right? I lost my thought. I was like, oh, what was I going to say there? Well, I'll move on because we're going to see more pictures of this. Oh, this is what I was going to say. Some people say, oh, well, I'm 50, 60, 70 years old, so that's just expected, right? I should see degeneration. But I just want you to look at this disc space. This disc space here, that lower one that we're talking about. How old is this one? And how old is the one right above it? How old are they? Oh, they're the same age. Because if it's an age-related problem, wouldn't you think that the joints age at the same rate and it happens in every joint? So you have to look at, well, what's the difference between that lower joint here and these upper joints that we're not seeing that change? Okay? Because all your joints are the same age. Let's talk about this really quickly. And we go through this because I think we often are pretty nearsighted or myopic in our view of health. Meaning, if it's not right in front of us, and if we don't feel it, we don't think about it. And until it's right in front of us, then it's like, oh man, it just started. It's going on. I got to do something now. And when we take a look at your x-rays and see if there's any levels of degenerative change, we start to see, you may think that it's right here and it's got to be now and it's been just going on, but it's a much bigger process than that. Healthy spine, it's all the way on the left side. You see that healthy disc space, you see that bone that looks nice and clean, no rough edges. Okay, phase 1 okay, let's go back. Healthy spine. It should maintain that structural integrity. What research shows is between 90 and 125 years before breakdown. That doesn't mean at 90, boom, we go kaput. That means that's when breakdown starts. And that's if we're taught to move our spine in a healthy way every day from early on for life. But we're not taught that, right? I mean, we are brushing our kiddos' teeth at like as soon as they come in. Oh, let's brush their teeth. We're taught to take care of our teeth on a regular basis early on. But we don't ever see the spine. So we see degeneration show up. So phase 1 is the only phase that's considered reversible. So, I mean, this is kind of starting to show you changes, but typically phase 1 is where we get change of the curve, anything that is abnormal from a healthy curve. Okay, we can reverse and we can change curves. Phase 2 is typically where pain shows up for most people. And that's where we start to see discompression. Okay, I mean, again, we only have 3 phases here, but I like to go through 5 phases. So by the time you're at this phase 2 scenario, I mean, really, by the time we see any changes show up on x-ray, it estimates between 5 and 30 years. So if we start to see structural change that's phase 1, you don't have pain. It's telling us, though, regardless if you have pain, that there's poor movement in that spine, there's subluxation type degenerative change happening, and it's been around for years, maybe decades, right? So you can start to see how it'd be a big problem if we're really focusing on what's right in front of us and how we feel. So this phase 2, we get thinning of the disc. Phase 3 is where you start to see bone spurring on the corners of the vertebra. So you can see how rigid that spine is, how compressed this is, how rigid that is. Okay. And I mean, really, as you move through the phases, you start to see complete fusion of a spine. So I'm going to jump into this because I want you to see this. Phase 1. Now, I took an axial plane view of a disc space. Okay. And I want you to understand, when you are in phase 1 degeneration, this is typically what's happening at the disc. Now, go all the way to the left. I want you to understand that your disc is a really fibrous tissue. And in the center of that disc is a really gelatinous bubble. It's like a jelly donut. Okay. And so we used to think that discs had no pain receptors. But actually what we're finding is that the discs do have pain receptors, so it can become a problem. But anyway, so you should have nice annular fibrous fibers that really surround that jelly in that disc. And so when you have phase 1 degeneration, what we start to see, and we have poor compressive movement, starts to push or stress that disc differently. It starts to rip and tear these outer fibers of the ring. So it starts to rip that. Okay. And if it's there long enough, it starts to get deeper and deeper towards that center of that jelly donut. So what this means is happening to the disc is the disc isn't as strong, isn't able to handle shock absorptions as much. Okay. And this leaves you to be predisposed to what we see, disc bulging, disc herniation. Okay. So phase 2. So again, that phase 1, disc health, is what happens when we just see changes of a curve. Again, most of the time people aren't feeling any pain. So phase 2 is where these tears get deep enough and they're starting to impact that disc's ability to maintain its state within the confines that it should be in. Okay. And so you start to get pushing, starts to push out here. When we get this is considered a disc bulge in the spine. Okay, that disc is pushing out from where it should be. I don't have a spine model here, but you can see when it starts to let go and it gets weak through here, you're starting to see that jelly also start to release. That's when we start to see disc compression. Okay. And again, what's phase 2? That's where we get disc compression. This is typically where pain starts for people. Now, if we continue in this process, phase 3 totally rips and tears and totally destroys this disc material as the jelly, this nucleus pulposus, has reached out into space. Now, understand that, this isn't an isolated portion of anatomy, right? Your body is compact. There is stuff all around this disc. So when things starts to push out, or when you have jelly that actually enters into a space, it's entering into other things. Okay. So you see the spinal cord back here. See where this is where the spinal cord is. This is where an exiting nerve is. When you have a disc bulge, you can see how it can impact a nerve that's coming out. So some people say, oh man, I'm feeling radiating pain that's going down my, into my glutes all the way into my leg. Right. So you start to see, oh, well, there's potentially a disc bulge here. Did it start with the disc bulge? No, it didn't, but it's been there long enough that the disc is impacted now the exiting nerve. It started with lack of movement or poor movement. We call it subluxation. It's been around long enough, and those compressive forces and lack of movement have now impacted this here, or this, this here, and it continues long enough, then we start to see, that jelly totally outside of space. This happens, guess what? We have tons of pain, and our immune system is activated because it's got to go in and do its job and heal and recover. This takes a long time when you have this. I mean, this is like 6-8 months of your recovery from this injury, this herniation, not even accounting for the degenerative change that's going on in your spine and structure as a result of poor long-term movement, right? So by the time you're at phase 3, it's been there a long time. And these people are really willing to act because they're in a lot of pain. And this is where pain is one of the, it's a great flag to get you to act. But the worst thing that can happen is pain goes away. Because what happens when the pain goes away? We stop doing the things that help this recover in the first place. But when the pain goes away, that's when the work really starts. And it's not something that happens overnight. It is something that takes months and years, depending on the starting place, right? So nothing occurs or fails in isolation. There is no one incident, right, that can only impact one thing. It impacts everything. Our body is an ecosystem. So when you think about this wheel here, right, if you have stress, or if you have fall, or you have poor posture, you gain some weight, it damages the joints. It impacts your musculature. Then you have an immune system reaction. Then you have swelling and ligament damage. Then you have pain, and then it limits your function, your ability to do things. And that is, unfortunately, kind of a vicious cycle. It just goes round and round and round and round, because it's not just one thing happening to us. There's like many, many, many things. We live in a really stressful world. I've heard this stat multiple times. The amount of stress we go through in a month, our grandparents and our great-grandparents experienced in their lifetime. I want you to sit with that. So what worked for, our ancestors does not work for us because of the life we live in. Our food is not clean. We have to work really hard to choose healthy foods and nutritious foods. We have to work really hard to do our posture interruptions to get healthy movement on a day in and day out basis, because our modern lifestyle is so confined to one posture. Not to mention the rest of life. You know what I mean? It almost just kind of makes me laugh when I think about all the stress, and add in COVID to it, where we've been totally isolated and told that, we can't find solace and connection in the people that have helped us through stress and, major things. We've had to do it in isolation, right? So I want you to understand that life is not getting any less stressful. There's more stress as we go. And we hear it with every generation. Man, it's not like it used to be. Not like it used to be. I'm saying that now. I'm like, man, school's not like it used to be. I'm turning into my mom here. And so, life is changing. And so I bring that up because that means we need to be that more conscientious and intentional about the things we choose to do to support and maintain health. And somebody said this to me today. They said, well, I'm thinking about this care plan you recommended, and I was talking to my dad, and the only red flag is he said his girlfriend's been going to a chiropractor and she's still going. It's been 5 years. So I'm going to have to keep going. Like, am I going to get addicted to this? And I think it's interesting that when you choose to do healthy things for yourself, there's skepticism, there's pushback, and there's lack of support. You can choose to stop drinking alcohol tonight. And you tell any of your friends, they'll say, well, are you sure you want to do that? Let's go to happy hour. You sure you just want to drink water tonight? Why are you buying that organic stuff? There's no difference. Come on, just eat some fries or whatever it is. You know what I mean? Like when you choose to do healthy things, you find the people closest to you kind of like, why aren't you eating sugar? Come on, it's just ice cream. Why are you going to the chiropractor? You know, aren't you going to get addicted to that? I mean, it's fascinating to me that we can't be more supportive of our fellow humans who are choosing to do healthier things, because we live in a really unhealthy world. And a lot of times, especially when we look at just what I presented to you today, is that we need to be so on point with how we move and take care of our spine, because it is literally protecting our brain and helps how we process our world. Like that needs to be a major part of our daily healthcare decisions. Is how are we moving our body today? How are we supporting good nutrition to our joints? We know we have good health and nutrition to our joints. Our joints are going to stay mobile and movement. We're going to age in a very different way than somebody who's choosing not to do that. So my answer to them was, you know, we can't make you do anything. Oftentimes when somebody goes through the process and really understands the importance of their health and their spine and their structure and what chiropractic does in terms of their spine, they realize, oh, I think this is something that I want to continue doing, whatever that frequency of care is, because I know not only do I feel better, I think better, I function better, but I move better and I can be a better mom, daughter, you know, wife, husband, classmate, colleague. And so, you know, we don't make anybody choose chiropractic care. There's always a start and end to every care plan. And we always ask somebody, did you find value in the care you received? And is this something that you feel is important and vital to continue in this next year of care? And most people say yes, whatever that frequency is. And my hope is, as you hear about the health of your spine and hear about really understanding arthritis and the more commonly arthritis that we see with most people, is that you will choose to take care of your spine differently for the rest of your life. We're all taking care of our spine, whether we're choosing to do that intentionally or not, right? So nothing occurs or is isolated. Everything is happening simultaneously. And our brain is so amazing that we don't have to think about half of it. It's just boom, 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 responding and integrating as best it can to survive and hopefully thrive in a world that is constantly bombarding us in every way. So I'm not even going to go into this. This is my last slide, but this is where I just want to end. I so appreciate you showing up here tonight, because there's so many places you could have been on a Tuesday night before Christmas. And you are here with us, and you are learning and understanding how your chiropractic care, I hope, can really set you on a trajectory of health, you know, on the long run. I know for you, you're thinking about what's going on in your body right now, and it is totally and very much important, yes. But we are all here thinking about, yes, and what is this trajectory? What is this person going to be experiencing 20, 30, 40 years from now? You know, Dr. Kristen has this story about, you know, her mom who was in a car accident, and if it was addressed appropriately at that time, maybe her life would be different now, right? But she can only do what is best now, you know? So thank you for being here tonight, being with us, and really, I hope holding yourself accountable to doing what's most right for your health and well-being. We love you. We appreciate you. Merry Christmas. Happy holidays. So grateful for you to be with us tonight and always. So if you have questions, you're welcome to ask those.